Medical tips for training Jiu Jitsu safely during the winter season. We Jiu Jitsu athletes are more susceptible to respiratory or airborne infections such as COVID, influenza, RSV, and pneumonia because of the proximity of the training partners. In addition, we are more susceptible to skin-borne infections such as ringworm and staph because of the skin-to-skin contact. Medical tip number 1. Keep your immune system as strong as possible during the winter through proper diet, adequate hydration, and adequate sleep. Consider adding an age and gender-appropriate multivitamin once daily to your regimen. If you smoke, consider quitting. If you drink alcohol, limit alcohol as much as possible. Medical tip number 2. Consider keeping your immunizations up to date, including your COVID boosters and your yearly influenza vaccine. Medical tip number 3. Consider wearing a mask in public or in big crowds. This will mitigate your risk of contracting an airborne illness. Medical tip number 4. Shower prior to training and after training. Showering prior will protect your training partners, and showering immediately after training will protect you. Medical tip number 5. Keep your no-gi and yes-gi apparel as clean as possible. Always show up to train in clean apparel, and always wash your apparel immediately upon getting home. Also, consider running errands and/or working in wash and wear clothing so that when you get home, you can throw the clothing in the washing machine immediately. Medical tip number 6. Don't train when you feel ill or are not feeling well in general. This will protect your training partners. Medical tip number 7. If you do become ill, reach out to your medical provider immediately for a proper diagnosis and treatment plan.